All right, so again, welcome. This is for Boyce 130 students. And what I'm going to do is I always find that whenever you're doing these reviews, and if you ever get stuck, and some of the parts where I get stuck with Boyce specifically is I don't have access to the types of questions that you get necessarily on your test um, like I do at Allegheny campus because I helped to author some of those tests, and so I know what is on their tests. But Boyce, I've kind of had to learn, vicariously through other students or what your instructors may have shared with me over the years. So I don't know all the details, but I know enough to know what you guys commonly miss when you take these tests. And so one of the things that I try and focus on is what's new compared to last semester and where you can get where you can have mistakes. So the first thing you need to remember or recall if you don't know already is that this test is next week. It's 25 questions. You have an hour to complete it and you can only miss two. If you miss three or more, then you need to remediate. You may need to remediate with me or some other nursing tutor. And then you have to take a retake and you need to pass that. And if you don't pass the retake, unfortunately, they're going to unenroll you um, from the 130 program. That might be different. There might be some more caveat to that, but from what I understand, that's the importance of doing these dosage calc reviews or taking those tests. So, um, so just make sure you're taking this seriously, practicing whatever practice questions you have access to. And like I said, if you have particular types of questions or when you look at the blueprint, like I have pulled up here, and you're like, I don't know what an intake output question is, or I don't know what an insulin dosage question is. That's a great question to ask during the review. Um, and then if you are like, you don't want to say that out loud or you want to keep it more anonymous, just send it as a direct message. I won't say who said what in the messages. All right. So you've pretty much seen everything on your on the 110 test. The thing that's different is the IV flow rate. So the flow rate question, so you're going to have calculating milliliters per hour or calculating drops per minute. So that's new for you this semester. And then when they say complex dosage calc, they just mean like it requires more than one step to answer. So it's more than just ordered over available. You might have to convert a patient's weight in pounds to kilograms, multiply that by like a milligram per kilogram order, and then solve for how many milliliters that particular thing is. So um, I'm going to start off by focusing on the IV flow rates, looking at the complex problems, and then we can come back to any of these other problems that usually you're pretty good and solid on because you already saw it in 110. But if you need to review reconstitution, if you need to review the intake, like the fluid intake questions, I'm happy to do that with you. All right, so let me get down to the flow rate question. So I think um, whomever tells you this, you guys are usually pretty good. The Boyce students are usually pretty good about this. You know you need to know your conversions, so just make sure you practice and know your conversions. All right. These are some of the practice questions that I've used over the last couple semesters. And so what I'm going to do is I'm going to get into these flow rate questions. I always like to start with the simple flow rate question first, simpler, and then get into more difficult ones. So I have a variety of questions here. Um, I want to see a couple that I have here that might be a little bit more straightforward. So I'm going to start with these two here. I'll start with this one here, which is the patients who received 200 milliliters of Ringer's lactate over 1.5 hours, and then what would you set the infusion pump to? Now, sometimes it'll just say, what would you set the infusion pump to? Sometimes it'll tell you specifically that they're looking for ml per hour. When we talk about flow rates, the thing you need to know is that a flow rate is just some volume over a measured amount of time. And the standard for when you're doing for nursing is going to be milliliters per hour. Okay. So if it doesn't tell you anything else, and I'll tell you some other things to look for just in case. But for the most part, you're just calculating milliliters per hour. Okay. Um, at, at Allegheny campus, this tends to be a question that gets missed. Is this the 200 milliliters, 1.5 hours? Because students are looking for math to do, which is really not math to do. It's just more so um, reducing and coming up with a succinct answer. So the way you're going to set this up is you're just going to take your volume, 200 milliliters, over your time, 1.5, and then you're going to reduce that, and you're going to do so just by taking 200 divided by 1.5. So 200 divided by 1.5, and we're actually going to get 133.333333. And so what they're looking for you to do is to reduce that to 133.3 ml per hour. Now, I know in every semester I deal with this. For the most part, you're probably not going to see a 0.33333 repeating with this type of question. It's usually going to end like with a solid number. But from what I understand, and unless your instructors tell you otherwise, and you can always verify this, you are supposed to round to the nearest tenth. But if there's any discrepancy, or you've been told like no, you would just put 133 ml per hour, I I would agree with you. But based off of the information that I know, that's why I always write my answer to the nearest tenth. Um, so I just wanted to let you know that that's why I do that. So if there's any discrepancy, just make sure you ask your instructor if there's a question about that. All right. So a similar question would be like this: 400 milliliters over 5 hours. You're just going to take 400 over 5, and then whatever that is milliliters per hour. I don't think that's too challenging. Um, a similar type of question is, instead of giving you milliliters per hour, they actually give you milliliters per minute. And so you're still wanting to know what the flow rate is in milliliters per hour, so you have to do some converting. So you can do this a couple different ways. I'm just going to show you the way I would do this. I'm going to take my 240 milliliters over 40 minutes. And what I'm going to do is I'm going to convert minutes to hours. So 1 hour is 60 minutes. So I'm going to take 240 times 60 divided by 40. So 240 times 60 divided by 40. And I'm going to get an answer of 360 ml per hour. So again, a lot of this, especially the flow rate questions, are just, can you make these conversions? If you can, great. If not, practice, because that's what you're going to see. Okay. The other thing you might see is it might ask you to calculate how much time an infusion is going to run for. And so again, you want to be able to manipulate the variables so you can get to an answer. And then like in the question here, the answer they're looking for is they want to know down to the hours and maybe even down to the minutes. Now, sometimes you'll just get an answer like 1.5 hours. So 1 hour, 30 minutes. Okay. Um, if I'll show you the alternative if you get something that's like kind of not 100% like the exact number you're looking for, and I'll show you how to get to that answer. But for this example, and I'm pretty sure on your test, your example is going to be very similar to this. It's going to end in a it's going to end as a whole number, so you don't have to guess what it is. So the way I would do this is, first of all, I'm looking at this. I have an IV of 250 ml. and I can see that it's running at an infusion of 100 milliliters per hour. Okay, so we just want to know, when is this going to stop? Okay, so you probably already look at this and you're like, well, it's going to run for 2.5 hours. You can kind of see that and rationalize that, but sometimes it's helpful just to at least write it out. So I'm going to take my 250 ml, and then what I'm going to do is I'm going to convert milliliters to time using what I have available. So 100 milliliters per time. So this is very similar to doing like a desired over have or ordered over available times quantity. But in this instance, your quantity is time. Okay. But we're going to get 2.5 hours. So 2.5 hours. And my guess is that they probably want you to write 2 hours, 30 minutes. They might be okay with 2.5 hours. I don't know. I just would make sure you have it listed there, because it specifically said hours, minutes. Now, what if we had something like, instead of 250 ml, what if we had, so I'm going to change my color here. That way, we can be talking about something a little bit different. So I'm just going to write purple. That show up? Okay. Okay. So let's say, as an alternative scenario, let's say instead of 250 ml, it was 225 ml. And it's still going at 100 milliliters per hour. Now I'm going to get, I'm not going to get a solid answer. I'm going to get 2.25 um, hours. Okay. Now, some of you might know, oh, okay, well, quarter hour, that's 15 minutes, and it is. But if you ever get to an answer like this and you're not sure how to solve for the minutes, what you can do is, if you take that 0.25, so 0.25, and if you divide it by, I'm sorry, not the 0.25, but whatever's in the decimal, 25, hold on one second, I'm going to tell you wrong. Oh yeah, 0.25 times, if you take, so let me erase since I'm getting ahead of myself. There's a couple ways I have in my head of how I wanted to do that, which is why I'm giving you different answers here. But if you take that 0.25, so I'm just going to write 0.25, and you multiply it by 60 minutes, okay? That will give you, so 60 times 0.25 is 15 minutes. So if you didn't know that a 0.25 was a quarter of an hour or 15 minutes, that's how you would do it. You just take whatever the decimal is, multiply it by 60. So if you got 0.3 times 60, and then that would give you 18 minutes, okay? 0.45 times 60, and then that would give you 27 minutes. So you can be very, very specific just by multiplying whatever your decimal is by 60 minutes. Okay. So that's just like, I don't think you're gonna have to worry about that. I just wanted to tell you that as an aside. That way you know that that's an option. All right. Okay. Now, the next thing is you're also going to be introduced to what are called drop rates. Okay. Now, drop rates basically just mean that you're going to be given some information about the flow rate, and then it's going to ask you to calculate how many drops per minute, and that's called your drop rate. Okay. So in order to calculate drop rate, you need two pieces of information. You need to know the flow rate, and you need to know the drop factor. Now, the drop factor and the flow rate should be given to you. The only time the drop factor won't be given to you is if they mention something like microtubing. Microtubing is it is telling you you're supposed to know that that's a standard, and microtubing equals 60 drops per milliliter. So I'm just going to write that up here as an aside. So microtubing equals 60 drops per milliliter. So that's a GTT, not a GH. I know that I wrote that kind of callously, but the abbreviation for drops is GTT. And you might be wondering, well, why isn't it DR? Well, DR was taken by as an apothecary abbreviation for DRAMS, DRAMS, and that used to be used in medicine or science, but they don't use that anymore. The only time that I've seen in recent, like nowadays, that I've seen the drums is in like on a bottle of perfume. So if you have a bottle of perfume or bottle of cologne, like at the house, if you look at it, it'll sometimes some bottles will say drums. So that's the only time that I've seen that. So, but in nursing at CCAC at least, you're not going to see drums listed on there. It's an apothecary unit and it's basically not utilized in medicine anymore. Okay. So you might see it in an old textbook or something, but shouldn't be seeing that anymore. All right. So, but microtubing is 60 drops per milliliter. I don't know that I've ever seen an example where they didn't give you that. Maybe on ATI you'll see that, and then now you know, oh, okay, they want me to use 60 drops per milliliter. So if they ever ask you for calculate the infusion rate and they give you a tubing, a drop factor, then they're probably looking for the drop rate. If they ever give you and ask for an infusion and they don't give you a drop factor, they probably want to know the flow rate in milliliters per hour. So you'll kind of see that and get a feel for that when you're looking at questions. But no one's expecting you to answer questions that you don't have the data for. Okay. That's why I mentioned the microtubing. That's the only example I can think of where they might say the microtubing is, and you need to know that it's 60 drops per milliliter. Okay. All right. So this is actually a really good question because there's some extra information about on here that we really don't need. So I already mentioned that the only thing you need in order to calculate drop rate is you need to know flow rate and you need to know the drop factor. So in this question, it tells us that we have an IV of 500 milliliters. Okay, so we have a 500 milliliter dextrose 5% water. It's infusing at 210 milliliters per hour, and that we have a drop, or we have a drop factor of 10 drops per milliliter. Okay, and then it says, what's the drop rate in minutes? So I need two pieces of information: flow rate, drop factor. This 500 milliliters, it's good to know that we have enough IV, but we don't need that information to solve for the flow rate. And the example I've always used in the past is, if we're both going somewhere, we're both going to get ice cream, we're going to meet up there, and I drive, my Chevy Equinox and you drive your Ford Mustang. Ooh, it doesn't really matter what we're driving. It's just we're talking about the rate. How quickly can you get there? How fast can you go? You have to go the speed limit, maybe a little bit more, maybe a little bit less, depending on where you are. But we just care about the rate. So we don't really care about how much, what it is. We just care about the rate. Okay. So in this example, the rate is 210 mil per hour. Now, what am I looking for in this? I'm looking for drops per minute. Okay. So what I want to do is before I get started with anything, I just want to convert hours to minutes. I want to be in minutes because that's where I'm going to be ending. And you don't have to do any extra math for this because you already know that 1 hour is equal to 60 minutes. So just do that conversion right there, or even before you write it out. A lot of times when I do these problems, I'll just write 210 over 60 minutes as opposed to writing out the whole hour. Okay, so you can do how you like, but if you prefer to write out the conversions just to make sure you're not missing anything, that's perfectly fine. Double check your work, make sure you're getting the consistent answer. All right, so I have my 210 milliliters over 60 minutes, which is the same thing as 210 ml per hour. And now I'm just going to multiply by my drop factor, 10 drops per milliliter. Before I do any calculations, you will see that we're already in the units that we're looking for, which is drops per minute. So I'm going to take 210 times 10, divide by 60, and I'm going to get an answer of 35 drops per minute. Now, one thing you need to know, if you don't know this already, about drop rates and drops, you can't give somebody a partial drop. So you can't give somebody like half a drop or an eighth of a drop or 8/10 of a drop. You have to give them a whole drop. So if you have an answer, like let's say it was 34.7 drops per minute, you would round that up to 35. If you had 34.4 as your answer, then you would leave it at 34 drops per minute. So you would follow your rounding rules, but drops are always rounded to the nearest whole number. Okay. So that is an important distinction between other other rounding things that you've been exposed to so far. So just make sure you're paying attention to when you have drops, round to the nearest whole number. And just as a reminder, you can't give somebody a partial drop. All right. Let's look at the next question, because the next question actually has some additional information that might be helpful um, to be able to answer or at least to show you what it means when they like kind of pad a question with extra information that you may not need to know. So let's just read through the whole thing and then I'll highlight kind of like the important stuff. So it says your patient is to receive Solumedrol 200 milligrams IV. Good. We know what med they need. It's received from the pharmacy in a 250 milliliter bag of dextrose 5% water to infuse over 50 minutes. Okay. The drop factor is 15. So as soon as I see drop factor, my mind initially goes to, before I even get to the end result of the question, it's most likely asking what is the drop rate. And that's what it says. It says, what is the correct drop per minute flow rate? So what are we looking for? We're looking for drops per minute. We have our drop factor. The other piece of information I need to know is my flow rate. So when I look at this, when it says your patients receive Solumedrol 200 milligrams IV, is milligrams a volume? It is not. Okay. It is not a volume. But what is a volume? 250 milliliters. That's our volume. And our time, 50 minutes. So I actually don't care. I mean, we care that it's, that it's 200 milligrams. We care like that that's what the patient needs. But we don't care about doing it for the calculation of these um, particular medications or the flow rates. All I care about is flow rate and drop factor. So what is my flow rate? My flow rate is 250 ml, 50 minutes. That's my flow rate, right? Volume over time. Now, initially, when you start working through some of these problems, you're going to be tempted to convert milliliters per minute to milliliters per hour. But when you're calculating for a drop rate, you're going back to minutes. So you're basically doing an extra step. So if it's in minutes, leave it alone. If it's in hours, convert it to minutes. Okay. But if it's in minutes already, leave it alone. Okay. So 250 ml, 50 minutes. Then we're going to convert using our drop factor, 15 drops per milliliter. This eliminates milliliters. We're left with drops per minute. And so we're going to take 250 times 15 divided by 50. And I'm going to get an answer of 75 drops per minute. So this is how you do these. Basically everything else is just a variation of those same types of questions. And that's why I put together a whole bunch of practice questions. Now, I do not have a specific, at least I don't think I have a key written out for these, but I did that intentionally. That way you can practice some of these and then we can go over those. And even if you can't come to the next, if you can't come to the next review session, if you just copy paste the question you have, I will go over it and make sure it's included in the review when you come back to that. Okay. So um I got so Holly asked, are we gonna can we go over insulin and reconstitution? Absolutely. So let's go ahead and jump into that next. That's what I was gonna say. I wanted to introduce you these things and then we can kind of review some of the things that hopefully are a review. I just wanted to see. I can't remember if I had them down here. Okay, here we go. So you're gonna have a couple of insulin type questions. Sometimes it's gonna be the sliding scale question. Sometimes it's gonna be you're adding two different insulins and then can you add two things together? Okay. So and then often also they might ask you to mark on a syringe for different things. So insulin is going to be measured in units, and we don't really convert insulin to milliliters. We always convert insulin and keep insulin in the units measurement. So like even when someone's a diabetic and they're supposed to administer their medication, it's going to be measured in units, not in milliliters. But on the label, you can see like, oh, okay, it's this insulin, this Humulin R is 100 units per ml, but there's specific syringes for insulin, which is why you don't convert that to milliliters. And you'll see that in some of the examples. So this question says, we're looking at a sliding scale. So this means this patient's in the hospital. They're evaluating his blood sugar levels, probably on a continuous blood glucose monitor. And we see at noon that it was 365, very high. Okay. So we look at the range for the different units as far as blood glucose levels. And we see that the 365 is right here in the 351 to 400 milligram per deciliter range. So what we're going to do is we're going to give this patient 10 units of insulin. So you just write how much insulin should be administered. The answer would just be 10 units. Okay. Then, so I'll just write that in here. 10 units. Now I don't so the only variation to this insulin sliding scale question is just what is the patient's blood sugar level? Okay. So if it was 400, would it be call the doctor? Yeah, that's a good question. So my guess is, yeah, I'm gonna say anytime that you're at the top of the range, so like where it says 300 to 301, this is interesting. So this should be greater than 401, but I didn't write the note here. So my assumption is that, and you might want to clarify this with your instructor. If it's 400, you might want to clarify what you should do in that situation. I think if they're at 400, probably a good idea to call the doctor. But I don't know that specifically. It's a good question. So the range is a little bit off here because normally like we could distinguish, right? So 250, 4 units, 251, 6 units. Okay. So I don't know if this was supposed to say 401 or not. So good question. I don't know. My guess is that you're not going to get that question where it's going to be like it's between two things. Even though sometimes you might feel like, well, that's exactly the type of question they're going to ask me. But I think they're going to more so just make sure you can read the range. Believe it or not, this question gets missed so often enough. Like, and I don't know what happens, but like I think sometimes you get used to like, oh, the practice thing was 10 units, the practice thing was 10 units, and then it tells you, 230, and then you're like, okay, 10 units. Like you just instinctively write the wrong thing. I don't know. All right. And then these I put back to back these reconstitution questions. So let's go ahead and do the Kefsol reconstitution. and then we can do the other one too if we need to. So the way you know you're dealing with a reconstitution question is it'll ask you a question very similar to how you would get any other oral based or injectable type of medication. But the label will be missing some key information. So like in a typical like Dilantin is like 250 milligrams per 5 ml. So you'd be giving that information. When it's a reconstitution, it you have to look at the label and you have to look at the fine print of the label to find out what the actual milligrams per milliliter you're administering is. Okay. So that's kind of a way to distinguish that. So a couple things to look for, especially for those of you that are going to get this type of question. When you see IM, right, that means intramuscular. Intramuscular means it's injected and it's injected as a liquid, and we measure liquids in milliliters. So if you're ever stuck with, well, how is I supposed to know that we're looking for milliliters? That's how you know. If it's IM, if it's SC, if it's IV, if it's SC, or I already said that subcutaneous, then that is milliliters. It's an injectable. The only time it becomes questionable is like if it's an oral medication, is it a liquid oral medication or is it a capsule or tablet? If it's a capsule or tablet, it's not a reconstitution because it'll say specifically, 500 milligrams per tablet or whatever it happens to be. All right. The other thing is if they tell you to shade the syringe, okay. Now I didn't include the syringe in this. I don't think it's down here either. I didn't include the syringe, but if they ask you to mark the syringe, just once you get your answer, mark the syringe. And that's another indication that it's milliliters. Okay. Because I know you don't always get told what, to solve for, but that's how you know. All right. So I'm going to look at my label. It says 1 gram. Now let me change my color here so we can't really see this. So it says 1 gram, and that's not very helpful, right? Because 1 gram, that doesn't tell me anything about how many milliliters. So I need to look at the label, okay? So I'm looking at the label over here, and what I'm looking for is what to do with that 1 gram of that powdered medication. So it tells us to add 2.5 milliliters sterile water. Then it says when we do that, after we shake it up, it's going to provide a volume of 3 milliliters. And then this is the important thing right here. What I'm looking for is that 330 milligrams per milliliter. That is your available. Okay. That's what you're looking for. So we're going to take our order, 375 milligrams, times our available. And again, you can do, if you do ordered over available, you can do this anyway, but as long as we're getting the same thing. So my available is 330 milligrams and my quantity is 1 mil. So I'm just going to take 375 divided by 330. And I'm going to get 1.136. So I'm just going to round that to 1.1 milliliters. So on my syringe, I would just mark 1.1 milliliters. So yeah, so that's your insulin sliding scale specifically, and then what a reconstitution question will look like. On the OneDrive share folder, I have a separate folder that just says reconstitution labels. The trick is just knowing like what they look like and what they're looking for. And once you get comfortable, like, okay, when you see that 1 gram and it's an injection, so you need to know milliliters, then you know to go to the label and then to the fine print and look for that. And it usually isn't any extra math that you need to do to calculate. You just need to find 330 milligrams per milliliter, or if it's 200 milligrams per milliliter, whatever it happens to be, you just have to look for that information. Don't use the 2.5 milliliters. Don't use the 3 milliliters. Use what it says on the label. All right. I wanted to see, I think I had a question here that might be a multi-part. Let me just double check, or a complex question. So let me double check. Okay. Yeah. So I have a couple examples of two-step questions. So let's look at this one here. Oh, go ahead. Question about weights. If you're talking, I don't hear anything. Okay, that's okay. I figure I saw that you unmuted, but sometimes if you click on the audio and it'll tell you to select your microphone. So sometimes you need to just change what that is. If you don't know what I'm talking about, that's as far as I know to tell you. Okay. So are you saying, so if you're saying when you divide the dose, that is more for next semester with pediatric dosages. I think that's what you're asking me. So like if you're supposed to administer, um, you know, 250 micrograms over three divided doses, is that what you mean? Yeah, if that's what you mean, okay, yeah. So that's more of a pediatric dosage thing that you'll get into next semester when you take peds. Um, and you'll have a whole separate like dosage calc like for pediatrics that is not this. So good question. All right, so I'm gonna go ahead and work through this here because it's a two-step problem, and then this will also address some of the weight-based questions that you might run into. So, first of all, how do you know you're dealing with a weight-based question? Anytime you see a question and it throws out this 3 milligrams per kilogram, okay, that tells you that you have to account for the patient's weight when we do this. So this is a pediatric question, but what Dominique was asking about is not you won't be responsible for the divided doses yet. That's next semester. Now, it says we're going to the orders for 3 milligrams per kilogram by mouth every 6 hours for pain for a child. The child weighs 73 pounds. Okay. So, and then it says you have an available 50 milligrams per 2 ml of the ibuprofen in question. And the question is, how many milliliters will you administer, or how much would you give per dose? Okay. So before we can do anything, we have to account for the patient's weight, pounds, and we have to convert it to kilograms. Once we do that, then we're going to take that number, multiply by 3, and then we are going to be able to find out what our milliliter administration would be from there. So let's do that real quick. So I'm going to take my child of 73 pounds, and I'm going to divide by 2.2. And what I get is 73 divided by 2.2, and I get 33.18 repeating. And what I'm going to do is I'm just going to round that number to the nearest tenth. Now, when you get into pediatrics, they might not want you to round um, that number, but for what we're solving for here, it should be fine. So I'm going to take that 33.2 kilograms. I'm going to multiply by the 3 milligrams per kilogram. And I'm going to get, it's 99.6. Times 3 is 99.6. So I'm going to get 99.6 milligrams. So once we get there, we know what to do with the we know how, or you should already know how to solve for calculating the milliliters. So let's say I'm doing ordered over available. Okay. I'm just going to take my 99.6. What do I have available? 50 milligrams, and then times my quantity. So I'm going to take the 99.6 times 2 divided by 50, and I'm going to get 3.984. Now, when you get that number like that and you're so close to pushing up to the whole number, one of the things I always pay attention to is look at the number here, 8, right? Eight's going to round 9 up to the next whole number. So your answer would be 4 milliliters. Now, if you're doing this when you get to pediatrics, there might be some caveats to that, but they'll explain those to you, meaning that for someone who's 73 pounds, being off by a few tenths of a milliliter, probably not a problem. But if you're dealing with like, a 6 pound, 10 pound, 12 pound toddler or infant, then those tenths of a milliliter could be very impactful. So it's important to know the different nuances, and that's why you go through pediatrics. All right. So I still I still have about 8 minutes or so left of this review. Are there any other questions? I know you already asked me about the insulin and then the reconstitution. We went over the flow rates, drop rates, and then what a two-step problem kind of looks like. There's a lot of practice problems here. Any questions? And what I'm going to do is while you're thinking about that, I'm just going to go up to the um, the blueprint. So if there's like a particular type of question you're just not sure of and you want to look over those, then we can do that. If you're otherwise good and you got enough out of this review, just know that I'll be back doing a Boyce 130 review on Thursday at 11 a.m. So 11:50. And if you have any questions, you can always email me. And if you feel good and strong and ready to knock this thing out of the park, then, you know, good luck on your test. Remember, it's next week. Make sure you practice. But I'll be hanging out here unless you're done.
Thank you.
Yeah, you're welcome. Glad you found it helpful.